Hello, everyone, and welcome. I apologize for our short delay, but I'm very excited to be here with Dr. Deniz Ahmadinia, tuning in live from Los Angeles, Beverly Hills, to discuss childhood trauma. Dr. Deniz and I met at a recent workshop held by Gabor Mate and Kimberly Shannon Murphy. Dr. Gabor Mate has been a major influence in my career path. And I recently learned about the work of Kimberly, who had significant childhood trauma, came out, wrote a book, and they held this amazing workshop together. And Denise and I were sitting in proximity and were able to spend some time discussing this very important topic that we often deal with in our work. Dr. Deniz, I'll let you introduce yourself and then we'll start.
Hi,
Thank you.
everyone. It's so good to be here with you, and thank you all for your patience this morning. It's so wonderful that we had the opportunity to connect. It just felt like it was meant to be because we've had such wonderful conversations during that conference. But I am a licensed clinical psychologist here in Los Angeles. I have a private practice in Beverly Hills where I focus primarily on working with trauma, including PTSD, complex trauma. And working to really integrate our evidence-based modalities with more of our body-based, mindfulness-based modalities that are becoming so much more at the forefront here. And just so excited to jump into this conversation because this is such an exciting place where our field is going, not just as a clinician, but for survivors, as a survivor, to just think about the amazing options we have for healing that are becoming more available to people who for so many have tried so many different modalities and practices and interventions and techniques for healing. So to be in a space where we get to talk about this is very exciting.
Thank you so much, Denise. I personally bring up my own childhood trauma often as it's something that I see as lifelong work on my behalf. And so it's amazing to be able to do the work and also help people sort of walk the path together. My personal trauma started with the journey of losing my mother at the age of 2.5. And so it was a very pivotal moment in my life because I was severely traumatized, but I have no memory of that trauma. So doing that work has been a lot of getting in touch with what's in the subconscious rather than being able to consciously work with memory. But it's been amazing, and the experience we had together at that workshop was really powerful for me as well. I'm wondering if there's any particular reason you focused on this, yourself as a career, and if you have any personal insights there.
Absolutely. It's funny because my answer now, all these years later into the field, is different than what it would have been even 10 years ago. Um, I think I originally thought the reason that I got into this field and trauma in particular was more for intergenerational trauma reasons. Um, the stories that I was told, what I was very aware of, was very prominent on both sides of my family, whether it was cultural trauma and wars and relocation or abuse that was in the family. It wasn't until much more recently that I've really come to understand the depths of my own trauma, which is both a factor of more of complex trauma that, is so much the fabric of our everyday lives that we don't always recognize it, as well as memories that I hadn't quite gotten to. Which is why I love this topic so much. So for me today, I can confidently stand in front of you and say the reason I am here is because of my own lived experiences. And I truly believe there's always been something inside of me, the same part of me that kind of held some of these memories waiting for me. I truly believe that's a part of me that led me towards this field, towards answers, towards questions, towards amazing mentors and professionals. Um, but to your point, there's something really amazingly rewarding when you've gone through your own trauma and you get to help facilitate that healing process for others. There's a different appreciation and empathy and respect for how arduous that process is, and that it truly is this lifelong undertaking that we all are on. And there's this amazing, I think that was one thing that struck me about being at this conference with all these folks is, people come from different parts of the world, different backgrounds, and yet we all have this shared language of experience in so many ways, even if we have all these differences.
Very interesting. You touched on the intergenerational piece, and I think that's an absolutely important piece. What's interesting about intergenerational trauma is that, when you have trauma, it has direct impact on the individual, on the community. There are behavioral changes that take place that have short-term and long-term consequences. Let's say a lot of the lifestyle habits even one has that are then passed down culturally. And then you have the epigenetic changes that take place, literally, both culturally and biologically, passing down behaviors until a particular individual is ready to do the work. And it's amazing that you've sort of seen the intergenerational route and have come to a realization of your own lived experience. And I think that's sort of what's required to actually do this in a deep way.
Absolutely.
Um, yeah, so I guess talking about intergenerational trauma, we both come from, so I guess West Asian type backgrounds, and in the Iranian culture, which is very similar to the Turkish culture. I feel like, there's this notion of mental health being something that doesn't actually exist. I think
Mhm.
that's one of the challenges that I find in trying to communicate the need to do work to people that I love, that I think would benefit from doing therapy or other kinds of self-development work. And so I'm wondering what your thoughts are on that, and if you have any tools that you use to help raise awareness, let's say, in a context where someone's not open to this notion of trauma.
Yeah, absolutely. What you speak of is, yeah, I think that spans so many different cultures. And just for those who aren't familiar with me, my background, I'm Turkish, Greek, and Italian. But so much, my husband's Persian, hence the last name, but so much crossover with these cultures and many others, where the idea of mental health was just not something, like it wasn't a thing, right? There like wasn't language for it. And even as language has come in, I've seen this in my own family. Sometimes there might even be on the outside a respect for it as a field, especially someone in the field who has a doctor title. But when it actually comes to someone being willing to engage in that process is quite different. And I think so many factors that go into that. I think one is so many of these earlier generations, especially our immigrant parents, grandparents, they face their own share of horrific traumas that they lived through. And I think there's often this comparison, sort of like, what do you have to worry about, right? You have a roof over your head, you have food, which of course are monumental in our sense of safety. But I do think that is one factor that plays into it. There's just such a disconnect that trauma can look all sorts of other ways, or there might be other life stressors that create valid anxiety or depression. Um, the other part of it is and this is the intergenerational piece that starts to look like culture when it's so widespread and common, is the emotional avoidance and emotional neglect piece. Um, that if you never had a model for talking about emotions, naming emotions, it makes sense that you then are going to relate to your children, the next generation, in that same way, where it's just not part of health, it's not part of family discussions. Um, and in fact, it might even be looked at more like, oh, you go to therapy to solve a problem versus to introspect, to have self-awareness, to better yourself, to heal certain things. There is such a disconnect. I do think one of the pieces, at least I've seen this in my own life, I'm curious if you've seen this too, especially as an MD. Um, for some folks in my life and beyond that maybe are a little more resistant to the idea of mental health being something that's important or valid, is the more connections we've made in terms of the science of what it means to have emotional health in terms of your physical health, right? That those two things are not separate from each other. And I think our Western way of viewing things does such a disservice to that. Because we act like, here down is one discipline, here up is another discipline. And I do think for some folks who have trouble grasping that, when you can help connect, and if you have to lean on the science and research to do so, that your emotional health is so significantly tied to your immune functioning, your physical health, your chronic pain, your fatigue, all these things. That I think has sometimes given more of a openness or a willingness if you couch it in terms of how this is affecting your physical health. But I think there's so many generations of conditioning around the messaging about what it means to address your inner world and your emotional health that previous generations viewed as weakness or something to hide or something that's shameful, that it does present such a huge barrier to people, sometimes even acknowledging that there's something worth exploring or worth getting the support around.
Yeah. Yeah, thanks. It's definitely challenging. I think the book that Gabor wrote, which is When the Body Says No, it's one of the ways in which I try to. Oh, nice. Right on. Yeah, exactly. Like that's one of the ways in which I try to communicate the message. And that's why actually my mom's cousin translated that book into Persian. We published it in Iran. I feel like it's a bit of a complex book, but the message is, if you're not in an optimal state of well-being, whether it's physical or mental or emotional, then there's something that is there to be addressed. And so that's one of the ways in which I try to bring it because, I think dealing with trauma goes from a range of all the way dysfunctional, treatment-resistant PTSD to someone who just doesn't have the right lifestyle. Like I think trauma can manifest in so many different ways on a spectrum. And so, on the path to wellness and healing, regardless of where we are, there are things that can be addressed, and that's how I try to communicate that message.
Absolutely.
Um,
Absolutely.
yeah, another thing that often comes up, and what's nice about our conversation is that my experience has focused a lot on psychedelics and offering psychedelic-assisted therapy to patients, which I view as a catalyst for the therapy process. And you come from a more traditional therapy background. I'm wondering if in your work you hit dead ends sometimes that you feel, might be sort of helped using, altered states of consciousness and experiences like that. Do you have any experience you can share?
Yes. So I'll share a bit of personal experience and a bit of clinical experience. And I think this is such an important question, whether you're a clinician or you're just somebody who's curious about these things, because I do think that's a question people often ask is like, when is it appropriate for me to explore this? Like, am I the right fit? And obviously there's a lot of nuance there, but I will share for me how psychedelics have played a role in my healing. And then I'll talk about some clients here is, I had been doing various modalities for quite some time to work on traumas that I had from childhood, through teenage years, and was working really hard, was doing all the things I was supposed to be doing, and almost felt like there was an itch I couldn't scratch, like something I couldn't get to, that I had an inner sense or an inner knowing that there was more there, but no matter what, just couldn't quite get to. And that was the point where I began discussing, a different treatment approach in my mental health to help me access something that I hadn't been able to previously. And it was life-changing for me, absolutely life-changing. And I think between myself and the therapist I was working with, had I not trusted myself and had I not had a supportive person who trusted my own gut feelings about things, I maybe wouldn't have had that opening given to me. And I say that because this is something I've heard so frequently in my practice working with survivors, is like an inner knowing that there's more that you can't quite get to, or there's just a block of something that you can't quite get around. But if you don't trust yourself, you haven't done that work to really trust your body and your sensations and your feelings, that's a lot harder. And if you don't have a clinician who's open to, or at least somewhat knowledgeable about there being other options other than traditional therapies, even somatic therapies, outside of that, then you may not have that opportunity to go down that path. So I'm so grateful for that. With clients, where I've given referrals or had folks come to me even after they've done psychedelic-assisted treatment, is similar situations where there was just a sense of there's something there that I can't quite get to. There have been folks who know exactly what their traumas are, but feel like there's emotional work that they just sort of get stuck in, and they're just kind of going through the same thing in traditional therapy. So that sense of stuckness. I think people who also are looking for almost that transcendental, transpersonal experience, where maybe they're also in the meaning-making process or trying to move towards a meaning-making process in healing their trauma. And, that psychedelic experience can give so much of that context beyond the self or meaning beyond the self, where, there's interconnectedness, there's intergenerational understanding. For some folks, it's very much there's a huge component of spirituality that becomes part of that. But I think we have wonderful therapy modalities out there, and so many that do hit on some of the same around the edges, the experiences that you might get with psychedelics, like those transpersonal experiences, the kind of dissolution of the ego, right, where there's like non-identification with thoughts and experiences, and with internal family systems, for example, right, a self beyond your trauma. And I think sometimes those are experiences people have in their psychedelic treatment that they don't always realize that they're going to get, but are extremely, extremely powerful, and often come through such a faster process than therapy. And I would say that one of the biggest reasons, which ties into the other ones that I mentioned, is when you have developed such strong defenses and protector parts around your pain, your trauma, that, those parts are just working so hard for you that they won't let you past. And I think that's honestly the primary reason that I've seen people, or I have referred people, is we've done so much parts work, so much emotion regulation work, building up that safety and that even relationship with inner child and younger parts. But it's just like that psychedelic work takes it, like catapults it to the next level, where there's just so much openness. And for others, it's the fear associated with revisiting those trauma memories, which in some ways is one and the same as the protector parts, right? But if the fear around revisiting the trauma or the level of dysregulation is so great that we can't actually safely revisit those experiences, you get really stuck in the work. So I would say those are some of the primary reasons that I've referred or I see that people have benefited from, or what really brings them to that leg of the work.
Yeah, thank you. Yeah, I mean, this is something that I've seen a lot as well, and I feel really privileged to have been able to offer uh, this sort of therapy legally in the healthcare system. And I love that you brought up internal family systems. It's such an interesting approach to healing, and it's so um, blended in with what occurs naturally in psychedelic experiences. And Dick Schwartz, who came up with that, talks about learning about it through his patients' experiences. And it's been my experience to see patients go through that. And what I love about it is that, you have this notion of the self with the capital S, so that all of us within us have the capacity to be that ideal self that we strive to be.
Yeah.
And if we are not that, then we have to ask the right questions and do the work to be able to discern what's causing it. And like you said, it's usually these defense mechanisms that start earlier in life. And the other piece that's really interesting is this storing of trauma in the body.
Mm.
It's amazing how, the intensity of the experience, especially as children, if we're able to reflect back on a time where we've had a traumatic experience and our autonomic nervous system is pumping, our sympathetic nervous system is pumping, and that sort of shock is almost programmed into our body. And it's been my experience that that's one of the reasons through traditional psychotherapy you might not be able to get past the sort of defenses because you're in your mind mostly, and you need to tap into the body. And you pointed out so well that this mind-body link is a lot closer than what most people realize, and how this dysregulation can cause all sorts of dysfunction in the immune system and the hormonal system and otherwise.
Yes. What is continues to be so striking to me, from my experience, as well as many other folks that I've spoken to that have gone through similar treatment and experiences, is almost the level of how intact some memories can be, almost like something's stored in a time capsule, just waiting for you, waiting for that sense of safety. Whether that's something that you're able to achieve through traditional therapy and more body-based somatic work, or through psychedelic work, um, I don't think we quite have a sense of how intelligent our bodies really are. I think we have barely scratched the surface of how truly intelligent the body is. And I do believe that that's something that we're able to access so much more in this psychedelic work, which is part of what's so exciting as a trauma clinician to think about. I think traditionally therapies historically have been an expert telling or guiding someone in their own healing process. But I think where therapies are moving, or circling back to, should I say, is putting healing back in the hands of the patient. We've sort of been given this message that someone else holds all the wisdom, rather than our bodies holding the wisdom of knowing exactly what to do to heal us, knowing what our different parts need. And I mean, that's that reference to the self, right? Is that there's a self that transcends all this pain and all this trauma, and so tied to body intelligence, that I love to see therapies that are promoting that honor that the body truly has this innate wisdom. If we can just like clear some things out of the way, sometimes it's those protector parts that we have to have step back so that the body and our internal world can really do the work that it needs to do, so that self can step forward. And I think that part of it is so significant. I mean, that's something I speak a lot about in my individual work with clients is, when our traumas start in childhood and we have these protectors and defenses that develop really early on, and you don't get the chance to really know who you are without those, you start to believe that that's who you are. And the freedom that comes with folks being able to do the work to access that self, that core self, that self energy that they talk about in IFS. Um, I think other therapies hit on it a little bit, like acceptance-based therapies, mindfulness-based therapies do a bit. But to know that you are someone separate from those experiences, that's not who you are, is hugely empowering and freeing for people, but can also feel like a very overwhelming undertaking of how to get there. But I do believe psychedelic-assisted therapy is a very clear pathway to start to illuminate um, what that self looks like, feels like, sounds like.
Yeah. Yeah, the workshop we attended, it was called Return to Self. And it's amazing because, like you said, we have these significant experiences as children, and we end up, eliminating parts of ourselves from our stream of consciousness, from our emotional and behavioral ways of being. And so it's a journey to go back and rediscover, and it often requires, facing some uncomfortable material to be able to sort of pass through and achieve that wholeness that we aim to achieve. And it's amazing because, the majority of the time doing this work, a successful and positive outcome results when the patient has the realization that there's an inner child that is somehow suffering or disconnected or exiled or abandoned. And it's about working with that inner child. And I know this is an area that you focus on, in your work. So, I guess one question I have is, how often is it, the inner child that's at the core of the problem? How often do you see things that aren't about the inner child?
Yeah. I would say all of us, no matter how healthy or unhealthy our upbringings were, have an inner child, and your inner child can be many different ages. Um, your inner child, just for those who may be less familiar with the term, you can think about it as a younger part of you that holds pain, unprocessed emotions, unexpressed emotions and experiences, and also all these beautiful, wonderful parts of yourself, right? Like creativity, playfulness, joy, things that we often lose access to as adults. So it's not just dark, negative, hard things. It's also these beautiful, positive qualities that often get lost, especially with traumatic experiences. So everyone has an inner child. Now, I think the primary difference for someone who had a healthier upbringing, maybe didn't have severe traumas, is their inner child might show up here and there. They might get activated in certain situations, but generally there's like an adult driving the bus. When we've had a lot of trauma and we have a lot of protector parts that have stepped in to shield us from pain or keep memories or feelings at bay, those parts end up driving the bus, um, which is great in the sense that it keeps you very protected from the very things that, originally caused pain. But for most of us, as we enter into adulthood, we no longer need all those parts to work so hard for us. And in fact, when you think about a child driving the bus versus an adult, it's a little scary because we're not making adult decisions necessarily. We're not making values-based decisions. We're making very fear and protection-based decisions. So in inner child work, we're often unearthing all our different parts, different experiences that have been suppressed, repressed, whether that's a memory, an emotion, or just a quality about yourself, right? It's like if you were in a home that just did not celebrate creativity or playfulness. And all of that was stifled, right? Like that inner child holds the pain of that. And the work is to, with all of our parts, is to help them feel seen, heard, and understood. And through this process, it's a very internal relational process where we're building safety and trust with these younger versions of ourselves. We build this trust so that they can, in IFS, you talk about unburdening, but it's really expressing and allowing a safe adult to witness and be there and offer love, comfort, and safety through those experiences so that those parts don't have to work so hard for us anymore. And over time, that's what allows that self energy to come through. It allows that adult you to step into the driver's seat. And that doesn't mean that those parts are just long gone. And in fact, the more we try to just push them away or push them out, we get ourselves stuck in all sorts of trouble that way. So this idea of wholeness really is so much about embracing all of our parts. Dick Schwartz, the book is No Bad Parts. It's that same concept that is mimicked in mindfulness-based work, self-compassion work, is embracing and offering compassion and love to all of our parts, no matter how difficult they are, no matter how much grief they've caused us, no matter how much shame we might feel about them or towards them. And that process just bringing that sense of wholeness so that self can step forward.
Yeah, thank you. The balance between self-compassion and self-criticism is something that most of us have a hard time
Oh,
maintaining.
yeah.
And that self-compassion piece is key. One of the staggering sort of statistics that I've learned about, and I don't remember the exact numbers, but from what I understand, people that have experienced significant trauma, let's say particularly sexual trauma is where I learned about this statistic. They are often the ones that end up doing the same thing to others, so like sort of unprocessed trauma in that sense makes you an enabler, turns you into someone who ends up becoming, let's say, if you've been a victim of sexual abuse, not doing the work could sort of, allow your subconscious to take over and for you to do it onto others. I'm wondering what your thoughts are on that, what your knowledge is and experience on this pattern of abuse being passed down from the abused.
Yeah. Um, so I'll speak about this broadly. I wish I had some research at my fingertips because I know there's some wonderful data out there. I think it is actually far less common for a survivor to become the perpetrator. Um, and there's a variety of circumstances that might promote that direction. I think where the repeated pattern more often comes from is the repression and denial of something, whether that's just within yourself or intergenerationally. That's where I've seen very commonly, and this I think is echoed in Kimberly's story. For those of you, if you're not familiar with Kimberly's book, it's called Glimmer. It's wonderful, about sexual trauma and intergenerational trauma. When you have denial or oppression about a trauma, you are potentially ignoring signals that someone is unsafe, right? Especially if we're thinking about, like, similar to Kimberly's story, where there's an abuser in the family, right? So say that abuser abused members of the family and they're not speaking about it. There's silence around it. That next generation is not as safe, right? Because if that first generation that experienced the abuse cannot speak about it, they are far less likely to recognize that that abuser is unsafe and that those children needed protection from that person. And that's the pattern that I more frequently see is the silence and denial around it, where it just keeps going until someone stands up and says, hey, this is happening. And maybe it happened to you too, or I know it happened to you, but you pretend like it didn't, and we're not talking about it. So that silence and denial, I think, is the more common path, but absolutely it can happen where just subconsciously someone might reenact, right? And I think we do see some version of that with most survivors of sexual trauma at some point in their journey, where when you've been at the hands of that kind of abuse, where you're powerless, you have no control, it's not uncommon for survivors to seek out situations, right? Sexual situations or partnerships where they are then the one who's in control. And a lot of people say, oh, this looks like promiscuity or having many partners. But what it is, it's a trauma reenactment, but an attempt for the survivor to gain a sense of control in a situation where they never had it.
Hmm. Very interesting.
Yeah. I know that
Thanks.
doesn't directly answer your question, but
No, no,
that's what I see more
I wanted
common.
to understand your wisdom and experience, and I think that's very helpful.
Glad
Very
to hear.
helpful.
Yeah.
Um, yeah, the most striking part of that workshop we did with Gabor and Kimberly was the notion that the trauma is the disconnection from the supposed caregiver.
Yeah.
So, that's what Gabor was saying is that maybe there isn't necessarily something inherently wrong with the sexual relationship, except the fact that you're sort of, as a child, you can't really give consent. So you're, in a sense, being taken advantage of. Let's say if you're being sexually abused by an adult, you can't really give consent. So that's obviously wrong. But he was arguing that the deeper wound, which precedes the act, is this connection from your protector, who should be your parent if you're fortunate to have one. And it was a very sobering moment for me to just think about that. And having a young child myself, it's an amazing privilege and opportunity to be able to have all this information and to try to have the right environment for my child and to maintain our bond, because the child comes out with a bond and it's our responsibility to maintain the bond.
So
And so, yeah, very, very interesting.
that piece of it, I think, is so significant, and I'm so glad that he brought that into the workshop. And just for context, for anyone who maybe some of you were there, but he essentially went around polling our group, our audience, for those of us who experienced trauma, who did you tell? And the majority of folks said no one. And this is so important because this is such a misconception around traumas. Why didn't you tell anyone piece? And what he was getting at is that children who experience abuse, especially sexual abuse at a young age, already know that there's no safety net for them, right? There's already a lack of safety, that they can't go to a parent. And the conditions have already been met, essentially, prior to that incident or repeated incidents happening. And that experience of emotional safety, right? You may have had physical safety, but maybe the emotional safety wasn't there, or both were lacking. But by the time a child has experienced that abuse, they already know that that parent is not safe to go to with anything vulnerable. And that he talked about as the primary trauma, because that's what we need so wired into our survival, is to have a safe adult, that's trusting, that we can rely on, that we know is going to protect us. We come into the world biologically with this expectation of being protected. And when that is severed or it's not nurtured in some way, that's extremely, extremely painful and overwhelming for a child. Um, but that primary trauma, I think that's something that I hope we continue to speak more about, especially in support of survivors, because that pointed question about why didn't you tell anyone is so shaming. And when people have someone safe and supportive to report their traumas to, that has a huge impact on their trajectory and healing. Um, Someone who's not alone in their pain, especially a child, right? This is different than if you have a relatively healthy childhood and then you have a trauma in adulthood, right? That's like our PTSD trajectory where it's like normal, normal, normal spike versus CPTSD is like all over the place. Um, so if you have that safe, healthy adult to turn to get support from when there's been a trauma or an abuse incident, your healing looks quite different than the child who has to hold that on their own, figure out how to protect themselves physically, emotionally, right? And this is where we see the development of all these very hardworking protector parts that we're now working in adulthood to get them to release the grip on our inner experience.
Yeah, thanks for that. Um, Another question I had for you was on the notion of false memories, and that's something that's brought up in psychedelics because sometimes, people may have realizations that may not be based on truth. I'm wondering if you've dealt with that in your clinical experience and how you sort of tackle that kind of situation.
Um, as far as in my practice, I can't say I've come across it. Um, I have come across situations where, similar to what I described earlier, someone might have the sense that there is something where there's like a sliver or a flash of a memory, that they're not sure if it's real or not. And I'm of the same mindset of Gabor Mate, what he describes in the workshop, which was trust your body. So maybe the image that you're seeing is not 100% accurate, but the pain that you feel in a certain place in your body, or the postural protecting yourself, or the continual hunching and shame-based posture. Like, trust your body. Your body is telling you something. And I think this is where, I wish I were extremely expert in this, but understanding how memory functions, especially around trauma, is hugely important. But the body is so stable and consistent, whereas our visual memories are a lot more susceptible. So that's one piece of that is I would say even when someone's accessing something in psychedelic work is what's happening in the body, right? What are you noticing? What are you feeling? And can we work to trust that? And that's really hard to do with also um, without trying to always make sense or make meaning of something, because that's what our logical minds do is they want to make a story that makes sense. And sometimes we can't always do that when we have fragments of memory or just body sensations. So that part of it. And then um, the other piece I would say is if you can look at that experience without trying to take something, if there's still uncertainty around without trying to take something as fact, um, just to recognize, like, does this fit what you've been experiencing in your life? Um, and I say that from this place of so many people I've seen in my own practice might come to me saying, like, I have all these symptoms, I have this experience, I struggle with this and that, but I didn't have trauma happen to me. And I will say more often than not, it's more of a complex trauma issue where it was just, again, it's like the air you breathe, you didn't recognize it, you couldn't name it. But when you actually learn about attachment experiences and safety, this and that, you start to recognize why some of that might be there. So I think holding that part of it is also important, is maybe we don't always have to know with full certainty about something, but does it also like map onto your life? Does it fit? And what does that mean for you? But not having certainty, I think, is something that's incredibly difficult. And I don't say that lightly to anyone because the mind wants certainty. It helps us make sense of things. It helps us make meaning of things. Um, but I do think that is something that we get a lot more clarity on in psychedelic assisted therapies, more so than traditional therapies. But I'm not sure what if you have different experiences with that in your
No,
work.
that's exactly it. Honestly, like anytime we're in a situation where there is lack of clarity, we go to the body. And, the body really has everything stored. And that's been my experience even doing mindfulness type practices like Vipassana, just to sort of talk about, again, my childhood trauma. While I was at my Vipassana retreat, which is a 10-day Buddhist oriented, hardcore guided meditation retreat. That's when, by awareness on the body, that notion of embodiment, I was able to tap into that deep sadness that was stored inside of me as a 2.5-year-old child. And I could literally feel, like you said, there's this consolidated memory bubble that just comes up, and I'm like, oh my God, this is that emotion, and I can pinpoint it. So I think that's right on. Um, I'm wondering if you want to tell us about your course. I know you have a course called Heal the Inner Child, and maybe tell people how they can find it.
Sounds good. I do have a 6-month program called Heal the Inner Child, and it is centered on inner child and parts work, building embodiment, really returning to your own authenticity and working towards uncovering the self, mostly for the first time for most of us. So it's a blend of pre-recorded video modules, audio meditations, a workbook, and a weekly group call that has turned into this wonderfully beautiful, supportive community. So you have 6 months to work through all of that, which is wonderful. You can move at your own pace because we all come into this kind of work with different skills and capacities and life stressors. But that is available to you. You can find it on my website or through my Instagram. And then next month, I haven't made a formal announcement yet, but while we're here, I'm doing a master class called Unmasking Dysfunction, which is going to be all about kind of the systemic family issues that can breed attachment issues related to narcissistic parents, emotionally immature parents that trickle down into so many of the things that we're talking about today. So you can hop on the wait list for that announcement as well on my it's on my link tree through my Instagram.
Very nice. Yeah, I guess that one is sort of the external family systems, as they say, in a sense. We're coming to the end of our webinar, and there are a bunch of topics that I think we can still discuss. So perhaps we can schedule another one of these. And one of them that was touched upon in that workshop was this notion of having narcissistic parents and the sort of wound that is passed to children in that sort of family dynamic. And so perhaps we could do another one of these where we delve deeper into that topic.
That would be wonderful. That would be great. Yeah,
Great. Thank you so much, Dr. Deniz. I do hope to work with you, and if you have patients that are interested in ketamine-assisted therapy, would love to work with you and offer that.
absolutely. It's so good to know that more practices and clinics are coming aboard and offering these services because we do need to get that education out to clinicians in the community so people know what options are available to them in their healing.
Yeah. And education, honestly, education is the most important, whether it's educating the professionals or the general public. I think there's a lot of misconception out there. And yeah, I'm really happy to have colleagues like yourself that are doing the solid work and helping people heal.
Thank you. Thank you. Well, I look
All
forward to the
right.
next part too.
Great. Sounds good. Thanks, Dr. Denise. Have a great day. Thanks everyone for tuning in
Thank you.
and talk soon.